Thank you, Acting President. I too rise to speak on the loneliness motion, motion number 654. I thank Ms. Patton for bringing this motion to the House. Human beings are social animals. We seek social interactions. It is a part of our evolutionary behavior. So it makes sense that when people are alone, they will face difficulty. Often, loneliness is used as a catch-all term. Loneliness is a feeling of distress people feel when they haven't had any meaningful social interactions. Research has shown that there are cyclical links between social isolation, loneliness, and poorer physical and mental health. In 2018, researchers from Swinburne University and the Australian Psychological
Order.
Society...
Can we quieten it down a little bit so we can hear Ms. Figala, please?
...conducted a national survey of 1,678 adults. Vic Health also conducted a loneliness survey of young Australians in 2019. Many people who were lonely before the pandemic would have felt increased impacts during the COVID-19 restrictions. The Andrews Labor government has taken a strong stance when it comes to the mental health. We have made the single largest investment into mental health in Australian history. We have committed $3.8 billion to build a new mental health system from its foundations. We have been committed to implementing all recommendations of the Royal Commission. In the final report of the Royal Commission, broad issue of loneliness and social isolation is covered. The Royal Commission's recommendation number 15 touches on the impact of loneliness on the mental health and well-being. It also recommends several interventions to strengthen local communities. We have accepted all recommendations of the Royal Commission, and we are working towards implementing all of them. The 2021-22 Victorian budget funded $16 million over 4 years for social prescribing trials. This funding will support this innovative new model. Through social prescriptions, patients are provided with non-medical support to help boost their overall well-being. Prescriptions can include developing hobbies, exercise, or even adoption of a pet. As recommended by the Royal Commission into Victoria's mental health system, social prescribing trials will be undertaken in the first 6 local adult and older adult mental health and well-being services sites from July 2022. Research has shown that loneliness is more common in young people of ages 15 to 25 and older people who are 75 and above. This initiative will support consumers, particularly older people. These trials will link to local community and social activities, including exercise groups, men's sheds, neighborhood houses, sports, arts, volunteering, and intergenerational programs. By getting people connected to the community, they should feel less lonely. Community is not just based on geographic space. It is also anyone who shares common interests. During the pandemic, the internet has enabled a lot of such support groups through shared interests. And now that we are opening up, people can form groups outside as well. Developing meaningful connections is the key to combating loneliness. Through these trials, we'll be able to see concrete results. Community collectives will also be established in each of the state's 79 local government areas to bring the community together to guide and lead local social connection and inclusion efforts. The collectives will take the lead in consulting with local communities to identify challenges and opportunities to promote community participation and take action to support the mental health and well-being of their communities. They will identify community groups at a greater risk of experiencing social isolation and social exclusion and work to inform the well-being priorities of each local council's municipal health and well-being plan. Each community collective will be supported by local government and made up of a broad and diverse range of community members and local leaders determined by the community. Research into social relationships and isolation have shown that positive relationships support good mental and physical health. There are activities that a person can do to lower their levels of loneliness, such as access to paid work, caring, volunteering, and active memberships in sporting and community organizations. However, the effectiveness of these interventions is mixed and not consistent across all cohorts. The Andrews Labor government has supported men's well-being and community connections through providing funding for establishing, expanding, or improving men's sheds. Men's sheds are safe and productive places where men can get together, build projects and friendships. They also contribute to the community through their projects. Men's sheds can have extraordinary benefits towards forming meaningful connections while upskilling. They promote social interactions and inclusions. The Andrews Labour government provides $1 million to support men's sheds each year. As I mentioned before, older people are at a higher risk of feeling loneliness. Seniors of the multicultural backgrounds may also feel the impact of loneliness due to cultural differences. Therefore, the Victorian government is supporting seniors from multicultural backgrounds. The Andrews Labour government has provided a share in $7 million to more than 900 multicultural seniors organizations over the next 4 years. This support of up to $2,000 per year will help the delivery of in-person and digital activities by community groups. I have met several seniors groups in the Western Metropolitan region, and I know how important social interactions and relationships are for that particular cohort. Yeah, that's fine. All these initiatives and supports help in removing loneliness and isolation for Victorians, and of course, a lot more still can be done for tackling loneliness. I thank again Ms. Patton for this important motion. Thank you.